Setting: Women and Children's Welfare Clinic. You are talking to a mother of 8-year-old boy who has bedwetting. 1. Reassure mother that her child's problem is common and can be fixed. 2. Collect a few details like how frequently he wets the bed, how much he drinks. 3. Assure mother that it is not his fault. Explain what the causes might be. 4. Suggest her to inform school nurse regarding bedwetting when the mother expressed her concern about school camps.
Hi. Good morning. Please be seated. My name is Brian. I am the registered nurse working in this pediatric clinic. How may I address you?
My name is Mary.
Mary. What brings you here today?
Well, I got a 6-year-old son, Mike. He's still wetting the bed.
I understand your concern, but don't worry. Most cases it's quite normal for children to wet the bed at night. So could you please tell me how often Mike is wetting the bed?
He is wetting the bed almost every night and I don't understand.
It's quite normal and very common for children to be dry during the day, and only a small % of children may wet the bed have medical problems. And actually, it usually runs in families.
Is anything wrong with Mike?
It's unlikely. Does he have any medical problems?
He is fit. That is why I'm confused. He doesn't have any sort of medical conditions. Still wetting the bed.
All right. Seems to be related to some other conditions. Like, children may have a small bladder and which may become overactive at night. Usually they go to the toilet often but at night, of course, they are asleep. Well, that's one possibility. And, some children may produce large volumes of urine at night, because the hormone that responds the amount of urine is not working properly. Some children have an immature bladder. And if they are deep sleepers, they won't wake up in time to empty the bladder. Another thing that you need to remember is that if children are constipated, the power may compress the bladder, that can cause the leakage of urine. Okay. And what do you think? How is Mike feeling about the bedwetting?
He is very upset because, I sometimes lose my temper, because if I have to wash the sheets every night, which I'm doing right now.
I know it's hard, especially if Mike is wetting the bed every night, and you just need to remember that. It's very common in kids.
And another thing is that the school is organizing a camp. What do you think? Should I leave in?
Yes, of course. School, camp are important for children. I understand why you have this question. You can explain this situation to the school nurse or any other teachers who will come to the camp.
I would like to ask you if Mike reduces intake of fluids at night. Will it have any effect?
Actually, bedwetting has nothing to do with drinking fluids in the evening. Some fluids, which contain caffeine, and orange juice, which are not good, because it can cause the increased production of urine. Okay, the best drink to have is plain water. So using the fluid intake will not have any much difference, is that clear?
Yes, nurse.
So I assure you that when he grows out, he won't get this problem anymore. Don't worry. In the meantime, you can use some plastic mattress to prevent bedwetting. What do you think?
Yeah, I'll definitely try that.
So I think I clear all your doubts. And do you have any other questions?
No, you've been really helpful. Thank you very much.
Thank you for your cooperation. If you need any help, please contact me at any time.